Hello, social workers. Welcome to 610. This is an awesome class. What makes this an awesome class is we're going to introduce you to a variety of therapeutic modalities, interventions, and techniques. It's cool. I love this class. And you get to practice them. You get to practice on yourself. We'll be using the Mind Over Mood book, and you get to practice doing some worksheets and reflecting on those. And then we're going to have you pick some clients to work with. We're going to have you pick some volunteer clients to do some interventions and intervention techniques with them. So let's talk about how we can do that in a safe and ethical manner for us as practitioners and for those who we choose. So first you want to choose someone. It can be someone over the age of 18. It can be a friend or roommate. Because this is practice, we don't need to worry about the dual relationship, and we're going to explain exactly to the client what this assignment is, and we're not actually treating them. So it can be a friend, it can be a roommate, it can be a fellow classmate. In fact, we're going to set up in the Q&A board a place where you can post you're looking for a classmate to do practice with. People can respond, and you guys can set up a time to meet. If you are picking a classmate, someone that you're able to sit face to face with, I am going to ask that you meet over an internet video platform. So Skype, Google Hangouts, FaceTime. That way, because part of the practice is being able to connect with the client and read their body languages, their facial expressions. Those are kind of the common factors that we're going to talk about in Module 2 coming up. So you want to make sure you can see them. So if it's not face-to-face, at least it be over video to video. So once you've chosen your client, the next step is you want to get their informed consent. Part of getting their informed consent is explaining to them you're a student and that they're helping you with practicing. You want to kind of explain the assignment and kind of the purpose of the assignment, so they have a clear idea of kind of what you're going to be doing with them. Also explain to them that you're not going to be using their real name. You can switch their names up. If there's any identifying information, you can also alter that, so they can speak freely, and we won't actually even use their real names. Also, if you are choosing a client from your internship, please make sure you've talked to your field instructor. Sit down with your field instructor and design a way that is the most appropriate way to get an informed consent to do any of these assignments with any of your clients in your internships. Make sure that you please talk to your field instructor and seek their guidance. Okay, so once you have you've gotten the informed consent, the next thing is begin to practice. Now, a lot of times we're going to have them identify an issue, and this is key because we want to have them identify a low-level issue and not a serious clinical concern. So we want to practice within our scope of practice as you as an individual, and also the scope of practice for kind of this class. So we don't want to help someone who's experiencing suicide ideations or major depression or serious mental illness. We want to kind of focus on kind of life transitions, someone who's just moved, someone who wants to stop procrastinating or have a goal, or wants to be more on time at work, or wants to be able to be more assertive or something like that. So there's a wide variety of things, but we do not want to practice without our scope of practice. If for some reason we begin the assignment and issues get brought up that are outside of our scope of practice, I want you to go ahead and stop the assignment. Go ahead and let them know, hey, this is out of my scope of practice. And then you can go ahead and help guide them to getting help. We're going to put some resources on Blackboard, national suicide hotlines, and different things like that. But you might need to make a referral to some counseling or different things in order to get the person help. But make sure we're not treating these individuals, so make sure that you don't begin to treat them. You get them the help that they need, and we practice within our scope of practice. Okay, so having done all that, those are kind of the main ethical guidelines that we want you to keep in mind. We also want you to go ahead and review the NASW Code of Ethics and make sure that when you're practicing in this class that you're keeping within the bounds of the NASW Code of Ethics and these guidelines. If for some reason, not if for some reason, but if you fail to keep these ethical guidelines, there's a couple things that could happen. We might do a standards referral to the standards board here at ASU. You might lose credit for the assignment. Depending on the severity, we may ask you to withdraw from the course or remove you from the course. I don't think that's going to happen. I think everyone's going to practice in an ethical manner. But I want to just make sure you do know the consequences. I want to make sure I'm giving you a clear understanding. It is vital that we practice ethically and safely. So I'm excited to do that and excited to be working with you, and look forward to it. So go ahead now and review the ethical guidelines that we just talked about, and go ahead and sign, complete the assignment below, and acknowledge that you have read and that you are, to the best of your ability, going to follow these ethical guidelines. Okay, thank you so much. Take care.